I remember they said, like, thank you so much. I get emotional talking about it.
Welcome to Millennials Looking for Mentors. I'm Klein Eliardi.
And I'm Elyse Notariani, and thank you to Jefferson Health, New Jersey for sponsoring this episode.
And speaking of Jefferson Health, today we are talking with Danielle Trotter. She is an advanced practice provider at Jefferson.
Among many other things. She does
many that we don't understand completely. So
yeah, we did
actually
have to have it explained to us.
But Elyse kind of had some big news over the weekend.
I got engaged.
Yay!
It's crazy. I didn't see it coming. I didn't even know we were that serious at this point. So,
No.
I hadn't even thought about marriage, let alone bothered him for years and years, every single day.
Or made a nail appointment a month in advance.
Yeah. No, I've been prepared for weeks. I didn't know exactly what was going on, but I've been prepared.
Yeah. Also, not to make this completely about me, but that nail color was 100% my doing.
It is a Klein Eliardi pick.
Yeah, very Christmas colors right now.
I know.
All right, but back to the reason that we're talking. So we should probably get that started. Because I don't want to screw up defining what an advanced practice provider is. I was hoping you could maybe give a brief explanation of what you do.
Sure, absolutely. So an advanced practice provider is actually an umbrella terminology, and it can refer to quite a bit of healthcare providers who have pursued an advanced degree, all of which would hold a graduate degree in their field. And additionally, we have specialty area training. So wherever kind of we end up, me, for instance, I work in pulmonary and critical care. So my orientation and so on, that's kind of my home and where I live in the healthcare world to date. So we can diagnose, we can treat, and we can prescribe. We can also bill for our services as well. And there are state regulations and governing bodies that differ a little bit depending on where you work and bylaws in the hospital. So I have a nursing background, so nursing is my root, and I am an advanced practice nurse, and I do hold a doctoral degree. So a doctorally prepared advanced practice nurse practitioner. That's a lot of words.
And what made you want to get into this profession in the first place?
That's a great question. I'd say I was really influenced by healthcare at a very young age. I was very close to my grandfather, also, who was I call him like my angel. He's no longer with us, but my angel on earth. And he just was someone that was really special to me in my life. Generally, his health was good, throughout, most of the duration of his living. But he did actually have an aneurysm, two aneurysms, and one of which he was saved emergently by healthcare providers, and he had a surgery to save his life. And unfortunately, one later was actually what he had passed away from when it actually started to leak. And I saw that in end of life. And I was just really, impressed overall by the experience of healthcare and what the capacity was to care, to give, to care for someone in such a vulnerable state. You make, immediate relationships with people you just met. And it's such a unique and incredible work setting that really I don't know that you're able to experience in any other field. And additionally, my sister is actually a physician assistant. So she's one of those APPs that, under that umbrella term I had referred to. So I watched, her journey through school, her learning, her experiences, her rotations, and hearing about it. And I was really impressed by that. So I guess that's where it kind of sparked my first interest to even get into the healthcare field and pursue this.
Yeah, that's fantastic.
No, it's making me feel like I don't do enough in a day. I sit in my basement all day and do this. So
this is great work. It's nice to connect and learn and it's fantastic.
Is there something that people would be surprised is a part of your job?
A lot of what we do as advanced practice providers, people are learning more about what that role is. And it was a term before, they would say you're a mid-level, and there's some stigma out there just with regard to using that term, that you're middle of the road or you're like a mid-level provider.
I can't imagine anything more frustrating than someone telling me that my whole profession that I'm so passionate about is a mid-level profession.
So sometimes people say it in a not a degrading way, but there is a lot of stigma around that. And because we are working as advanced practice providers to get the word out there and tell people, what our education is, what rigor we do go through in terms of, getting where we are. So I think just what people might not know is just, all our capabilities and really what we can do and maybe the degree of our training and how we got to be where we are. And I think that a lot of times too, there's people working in all different settings. That you'll see us in outpatient, you'll see us in the ambulatory setting, which is outpatient. You'll see us inpatient in the hospital. But additionally, you can have leadership roles. That advanced practice providers like myself have grown into leadership roles, and I'm connecting across organizations. Collaborating with a lot of high stakeholders in the system, operational decision making, looking at metrics, looking at quality improvement, how we help our patients. And you might not be, or I may not be. I am directly at the bedside, but now my role is shifting, and I have that administrative role as well. But working in tandem, that you're still helping the patients, just in a different way. You're giving a different insight from the bedside and using all of what you've learned and applying it, from this administrative role.
Do
So
you have
that's what
any patients, their stories that have stuck out to you?
Yeah, I mean, I have so many that I can remember to this day, like it was yesterday. I had experiences in nursing school, even in clinicals that really just somebody stuck with me that, reminded me of like, this is what I'm meant to do. Most recently, I recall, a patient I cared for during the pandemic. Patient did not want the family visiting because they were so afraid, just that the family may get sick. So they were alone in the circumstance, and it was very tough. So, but they communicated to me that they really wanted a Dunkin' Donuts coffee and a donut. And I went right out and made sure I got that, and I brought that back to them. And I remember just the smallest gesture and thing that made the patient's day. And before I left, I remember they said, like, "Thank you so much." I get emotional talking about, but like, "Thank you so much," and how much that meant to me. And they said, like, "Danielle, always remember it really is the smallest things in life." Um,
Yeah.
and I think that's like such a takeaway to for everybody, that it really can be. So those small things can get you through, and like holding on to those moments where you connect, and that keeps you going, like remembering how I felt and how much of a difference you can make for somebody's life. And that's so powerful. And I think it's so unique to healthcare, and to what we do, that it's a tough job. Like, it is a very tough job. But I think that, it is so amazing to have the opportunity to really impact people's lives. And that's what keeps me going. So
Well,
That's
thank
amazing.
you so much for sharing that.
Can you tell us a little bit about what it's like to onboard a nurse? Because the idea that you go from there's someone next to me helping, not helping me, but watching me do these life-saving things to, oh, just kidding. Today we're doing this on our own sounds terrifying to me.
Yeah.
yeah, it's certainly a process, and I think that we have a lot of novice, or newer graduate nurses in the organization, and actually just across healthcare as a whole. And it's incredibly important to make sure you're investing in their orientation, both for that specific nurse, for the organization, and for the safety of the patients. So you want to make sure that you're putting them with a preceptor who is engaged, someone seasoned, someone that you want to make sure they feel safe with, that they can ask questions, that they can support their learning day to day, and make sure that this nurse that's new is getting the essentials, making sure that they're retaining those skills. Because you certainly learn a lot in school, you certainly learn a lot in clinical, but there are just some things that really can't be taught, or you have to learn it on the job. And that is a big learning curve, actually, when you come to healthcare in any position. There's just things that you haven't experienced, difficult conversations with patients, or just, acute changes that you weren't expecting, or so forth. Knowing what they don't know is a huge takeaway. We always like to say, like, knowing what you don't know, so you don't overassume or be overconfident in areas where, that could be dangerous. So that's a big takeaway as well. And it's really a lot of, rigor in terms of the orientation. And they really try to set it up where you're with someone for, certain amount of weeks. You might do some different, day shift rotation, night shift rotation. So you kind of see the ins and outs and get a lot of exposure and experience with that. A lot of training classes that they'll attend, online learning, but also like simulations as well to help support their learning too. So
And are
That's
you still in the middle of a nursing shortage?
I think the pandemic, truthfully, it it really highlighted some things that were already happening or going on, or some issues that were already going on. Also, I think, we have, based on where we are in the timeline of things, right? We have a lot of seasoned, nurses that are like our baby boomers and people retiring. And now you also have an influx of like newer grads or newer nurses coming in, but you might not have as many people to train them, or, so they're coming in at this really challenging time. There's like this kind of like an experience gap time. And then on top of it, patients are much sicker. The complexity of care is much more difficult. And then you have, these newer nurses that are now coming in and they're being challenged to care for just much sicker patients. And all of that really adds to everything in terms of job satisfaction, keeping people here, wanting them to stay, people feeling like, they have the stamina to continue working. I don't think that there's one single thing you can do to just make it all better. But I do think that there are things to help, and one of them is, organizations really listening to the staff, listening to the providers, and wanting to hear what it is they need. Why are they staying, and also why are they leaving? So, like, stay interviews to figure out what keeps people here, and then also like why did they leave? Like, what was going on, and what are ways we can help as an organization to make this better? Because I also think, there is only so much that individuals can do to keep themselves from burning out. And I think that my current organization is doing a good job with that. I think that they are, it's not perfect. Again, there's still certainly things going on, and people will, if you ask them, they might have a different opinion, and you ask everyone individually. But I think as a whole, seeing like leadership, looking to find ways to make this better, getting creative with staffing, being more flexible, um, finding out, because finding out ways to help with wellness, that it's not just, go on and do mental health, CPLs and things like that. Like, actually bringing wellness to the provider. Like, what can we do to actually bring it to you? Um, I actually joined a temporary action group we're called of like to focus on wellness, and it's a mix of advanced practice providers and some of our physicians. And we're doing we sent out a survey to get some information. So some quantitative information is just ask some questions, but we're also going to do some focus groups. So meeting with the providers, individual, in a group, in a small intimate group, and kind of really just opening the dialogue about it, saying like, we care, we're here, we want to find this out, like what can we do to help, what's bothering you, and all of those things. And I think the more information we get will then help us to, help this situation.
How did you get people to take that survey? Because I've sent out surveys before and no one touches them. And you just get them back and there's no information.
It's tough, and I think also right now it's time when there is a lot of stress, to get people to do things, right? Like to get them engaged and motivated. It's a challenge, but I think that trying to use your voice to kind of spread the word, if you're dissatisfied or unhappy, instead of just complaining about it to your peer or this and that, like say like, what can we actually do to make a difference? Use that frustration to push you to actually participate in the surveys or do different things like that to see if there's actually an avenue to make a change, and have your voice heard. So a lot of it was word of mouth, like, hey, please do the survey, this is what we're doing and this is what it's based off of. We really do actually care. This is what we're trying to get information wise.
Yeah. And obviously, I mean, people across the country can do the same job and have it experienced very differently. What is it about Jefferson that not only made you want to go there in the first place, but has made you stick around as long as you have?
Yeah, I think that, Jefferson, there was a lot of opportunity for growth at this organization. I think that anywhere you're working, you want to make sure you align, with that organization, that you have the same, values and mission statements, and you really connect in that respect. And I feel like for myself personally, I've aligned with Jefferson in that way. Their mission, is to improve lives, and that's something I'm extremely passionate about. They value putting people first. That's absolutely something I align with. There's people there that I've known for such a long time. That's been a big part of it too. Back when I was a secretary, all the way till now, there's nurses that have worked there for a long time, that are seasoned. And when I see them at work, it always, just makes me smile. They always are introducing me, remembering, like, I remember when Danielle did this, or when she worked. And it's so nice to have, good people where you work. And I think that is certainly important to help with retention.
And for you, like, how was it trying to figure out how to balance, providing really good healthcare and also providing customer service? Because they're not necessarily always the same thing.
That is true. It's not always the same, but I think in healthcare, it does really blend a lot, in what we're doing. Because in order to care, for the patients, we have to really make sure they trust us. Trust is a huge foundation when you're coming in, when you're looking at the patient, making eye contact, caring, asking them questions, getting to know them, as a person, and building that rapport. That patient, in turn feels valued. I think it's really important as providers to also make sure you include the patient and remind them that we're a team. You aren't just defined by your diagnosis. Certainly isn't always sunshine and roses. There's definitely challenges, extremely difficult conversations. A lot of times you're seeing people, right, in their most vulnerable time. They're dealing with a lot of stress. Everyone handles stress differently. So I think also, being able to see through that. And I think that's a part of healthcare that I'm always just incredibly taken back by, is, there is the medicine portion of it, the physiology, all that, part of it. But then there's this like qualitative aspect of it that you really don't always, hear about or see or even learn. And it's a lot of that on the job learning, like we mentioned, of how to navigate, like how to, help someone through a really tough time, and they're having a bad day, don't take it personally, and kind of see through that.
So I feel like a big part of nursing that could deter a lot of people is the fact that you are going to lose patients. Like, it's just not, it happens. That's part of the job. That's not an easy thing to deal with. How do you handle that? And do you remember early on figuring out how to deal with that?
That's a really great question. And I think it's certainly on the minds of people, who'd be considering even going into this field, or doing that. We talk about, how there's things are taught in school. They do touch on, some of the things in terms of how to handle stressful situations or face that. But again, a lot of it actually isn't until you're on the job, where you're in these situations, that you're realizing, circumstances, and figuring out how to navigate, this really tough situation. And I think it is a part of, the process of learning, like, what it is to be a nurse, and being at the bedside, and that relationship with the patient. And it can be tough. I do still to today remember my first, code, the patient that coded, had just had a relationship, talking to this patient in the morning, and then, then they're gone, and it's very tough. Um, and I think that it's important for people to know, the difference that you're making in the lives of these patients, to remember your why. Like, why did you even want to consider doing this? That you're impacting care, you're impacting lives. Like, you're such a key, nurses are such a key in the healthcare, APPs and all of them are key role in patient care, patient outcomes, and what you can do and give back, keep that with you, to go through your journey. Um, and even though there are tough situations, I think it's important to lean into them. Sometimes people kind of, turn off or just disassociate to cope, It's sometimes everyone copes differently. And I think it's important to kind of figure out what works for you. How do you cope? How do you get through your day? But a lot of times people do kind of disassociate. And I think actually it can help to lean in the moment. If you're feeling really upset and you're feeling bothered, to say, listen, this is something that's okay to feel.
You've been in school a lot. Is that a correct statement?
Yes,
Before? Okay.
I would say that is correct.
Yeah.
Many years of schooling for sure.
And you were in school while you were also working, right? And not like working your 9 to 5 in your cubicle at the computer, like working in healthcare on the floor. How do you balance those two things that are happening at the exact same time and are very stressful, either one of those on their own to a person?
For sure. It is, it's tough. I looking back, I'm glad that I did what I did and how I did it. But in the moment, sometimes you're like, this is wild, this is a lot to handle. I think that you have to kind of assess yourself as an individual. Like, is this something that I can do? I can handle? I'm someone that really functions well with a lot on my plate. That's just kind of been what I am and who I am. But I think that prioritizing is really important. I also think it's very easy to overthink or think of all you have to do, and that can be very stressful. And I find sometimes, just saying, let's focus on today. Let's focus on today. What's on my agenda? What do I have to get done? Things like that, and kind of setting yourself up in like smaller, shorter goals can help you get to that bigger, vision. When I was working full time, in the neuro ICU, it's a tough setting. It's a high acuity environment. You're caring for patients. You can't have an off day, in healthcare. And I think that's another part of what kind of all this connects. Like, you can't just walk in and like, yeah, I'm just not gonna, I'm just not feeling it today. Like, I'm just, gonna take it easy. Like, there's really not taking it easy. Like, you just can't do that because, oftentimes then something of some sort will suffer, or, and I think like that's the toughest part. So you kind of have to just be like, well, I'm here. I'm gonna bring my all, and bring my A game.
Yeah. That sounds great. No, but yes, thank you so much, honestly, for doing this and sharing those stories.
Thanks to Danielle for joining us on this podcast.
She's the kind of person that I strive to be, where I'm like, oh, I'll follow up with people and like stay connected with them and reach out to them and stuff. And she actually did that after the podcast. Like, we actually had some email exchanges, and she directed us to her Instagram page, which everyone should go follow. It's at DNT_the_DNP. We'll post that somewhere because I just heard how many letters in that sound the same.
Lots of letters.
We'll put that in the description of the episode so that you can go check her out and follow along her story.
And make sure you tune in next time. We have new episodes of Millennials Looking for Mentors every other Wednesday.
Plus, if you know someone you would like us to talk to, email us at mlfmpodcast@gmail.com.
See you next time.
Bye.
Yeah. Bye.